So, a good day, class. Today we are going to be talking about the gross anatomy of the diaphragm. Actually, the diaphragm is a very large dome-shaped musculo tendinous partition that separates the thoracic cavity from the abdominal cavity. Okay, it's actually the principal muscle of respiration, and you expect it to play a very vital role in breathing, venous return, and maintaining the pressure differences between the thorax and the abdomen. Now, anatomically speaking, the diaphragm forms the floor of the thoracic cavity and the floor of the abdominal cavity. Okay. Now, when relaxed, it forms two domes that project upward into the thoracic cavity. Now, during contraction, it flattens, thereby increasing the vertical diameter of the thoracic cavity and allowing inspiration. Now, what is the general shape and position of the diaphragm? The diaphragm has a double dome shape. It has a right dome, which is higher because of the liver. It has a left dome, which is slightly lower because of the heart and the stomach. The highest level of the dome, the right dome, for example, approximately fifth rib. Then the left dome is approximately fifth intercostal space. So when the diaphragm contracts during inspiration, it descends by about 1.5 to 7 centimeter, depending on the depth of the breathing. Now, what is about the structure of the diaphragm? The diaphragm consists of a peripheral muscular part and a central tendon. All muscular fibers converge towards the central tendon, which is, of course, strong aponeurotic sheath. What about the central tendon? The central tendon is thin but very strong aponeurosis located near the center of the diaphragm. And it has some characteristics. For example, it's shaped like a tree-leaf clover, fused superiorly with the fibrous pericardium, and of course is non-contractile, and of course you expect it to receive insertion of the diaphragm muscle fibers. Okay, now because of its attachment to the pericardium, movement of the diaphragm influence the position of the heart during breathing. Okay, this is very, very important note to take. Now, what about the origin of the diaphragm? Now now the diaphragm originates from three parts. Okay, sternal part, costal part, and lumbar part. The sternal part originates from the posterior surface of the xiphoid process, and this is actually the smallest portion and may sometimes it may be absent. Then it has a costal part. The costal part originates from the inner surface of the lower sixth rib and their costal cartilage, that's the 7th to 12th rib. And now these fibers interdigitate with fibers of the transversus abdominis muscle. Then there's a lumbar part. A lumbar part arises from the lumbar vertebra through the muscular extension called the crura and acute ligament. Now we have the right cruise, of course. The right cruise originates from the bodies of the L1 to L3 vertebra, I think, then intervertebral disc. Then we also have the left cruise, which originates from the bodies of the L1 to L2 vertebra. And of course, this crura that we are talking about anchor the diaphragm to the vertebral column. There's also something very important called the acute ligament. There are three acute ligaments, okay, and they form fibrous arches that allow structures to pass beneath them. Okay, we have the median acute ligament, which is formed by the right and the left crura crossing over the abdominal aorta. Okay, we have the medial acute ligament, which extend from the vertebral body to the transverse process, and of course arches over the psoas major. Then we have the lateral acute ligament, which extend from the transverse process of L1 to the 12th rib. Okay, arcing over quadratus lumborum. All right. Now, what about the insertion? All muscular fibers converge to insert into the central tendon, okay, of the diaphragm. Now, opening in the diaphragm. Let's talk about the opening in the diaphragm. The diaphragm has three major openings that allow structures to pass between the thorax and the abdomen. We have the cava opening, that's it, at the T8 level. Structures passing through them is the inferior vena cava, the terminal branches of the right phrenic nerve, the lymphatic vessels, of course, is located within the central tendon. Now, during inspiration, this opening widens, helping venous return, of course, to the heart. Now, we also have esophageal hiatus, which is at the level of T10, okay, T10. And structures passing through is the esophagus, the anterior vagal trunk, the posterior vagal trunk, the esophageal branches of left gastric vessels, and of course this is also located in the right cruise of the diaphragm. Then we have the aortic hiatus at the T12 level. The structures passing through is the descending aorta, the thoracic duct, the azygos vein, and this is actually formed by the median arcuate ligament. There are also other smaller additional small opening, okay. Other structures passing through small gaps include the sympathetic trunk, which is behind medial arcuate ligament, the greater and lesser and least splanchnic nerve, the superior epigastric vessel, the musculophrenic vessels. And what about the blood supply to the diaphragm? Now, arterial supply actually comes from several sources, really. Okay, we have the superior surface, which is actually coming from the pericardiophrenik artery. I think pericardiophrenik artery. We also have the musculophrenic artery, which also supplies the superior surface. Then we have the inferior surface, which is supplied by the inferior phrenic artery. And the inferior phrenic artery is actually from the abdominal aorta. Then we have venous drainage, which is from the azygos system and the inferior vena cava. What about the nerve supply to the diaphragm? Well, the nerve supply has motor supply, which is from the phrenic nerve, that's the C3, C4, C5, yes. Then we have sensory supply, which is from the central diaphragm, from the phrenic nerve, and then there are also peripheral diaphragm, which is from the lower intercostal nerve, that's the T7 to T12. Now, a classic teaching statement here would be that the C3, C4, and C5 keep the diaphragm alive. Now, there's also something very important I've not mentioned, which is the relations of the diaphragm. Okay, superior relation of the diaphragm is the lungs and the pleura, the heart and the pericardium. Inferior relation include the liver on the right side, the right kidney, the right suprarenal gland, and on the left side we have the stomach, the spleen, the left kidney, and the pancreas. Now, what is the function of the diaphragm? I've already mentioned function of the diaphragm in this instance, but it has a primary function which includes respiration. You know, the diaphragm is the main inspiratory muscle. Okay, now increase of thoracic volume, contraction increases vertical diameter of the thoracic cavity, and increase of intra-abdominal pressure is actually important in defecation, when you're pooing, micturition, vomiting, and even in childbirth. Okay, then we also have venous return. Okay, the diaphragm helps in venous return. It helps pump blood towards the heart during breathing. Of course, there's something we didn't mention, which is the developmental origin. Although, let me just state it briefly, since it's not embryology. You know, the diaphragm actually developed from 4 embryological structures: septum, transversum, pleuro, peritoneal membrane, dorsal mesentery of esophagus, and muscular ingrowth from the body wall. So, once there's a failure of proper fusion, it may actually lead to congenital diaphragmatic hernia. And what are the clinical correlation of this diaphragm? We have diaphragmatic hernia, where the abdominal content may actually herniate into thoracic cavity. We have hiatal hernia, where part of the stomach protrudes through the esophageal hiatus. We have phrenic nerve injury can occur, which leads to paralysis of the diaphragm, and there could also be referred pain, where a diaphragmatic irritation may actually cause the shoulder pain due to phrenic nerve supply. Once there is referred pain. So the diaphragm is actually a musculotendinous dome-shaped partition separating the thoracic and then, of course, the abdominal cavity, and is actually the primary muscle of inspiration. So I think this is a good information of the diaphragm for now. So see you next time. Thank you.